Well, our next guest is here to talk about a growing trend in healthcare that many of us call concierge medicine. Now, prior to her career, she attended Siena College, where she graduated summa cum laude with a bachelor's of science in biology. Then she went on to earn her MD from the Medical College of Wisconsin, and then she stayed there to pursue one of their community family practice training residencies. And during her residency training, she even served as chief resident. Now, she happens to run her own direct primary care practice, which we'll learn about in a minute, in Hoffman Estates called Mindful Medispa Mediclinic. So it's my pleasure to welcome Dr. Lucie Bianchi to the Retire Wiser Chicago Summit. Welcome.
Well, thanks a lot, Jim. That was a lengthy introduction.
Yes, absolutely. I'm glad to have you here because this is something that's more and more people are talking about. And maybe you could just start us off. I mean, I use that term concierge medicine, but that's my understanding is not the best description or doesn't describe everything. So maybe you can kind of tell us what that is and how that compares to direct primary care, which is the term that you use and lots of others use now.
Correct. Yeah. And I think concierge medicine is kind of like an incorrect way to think about it because when people hear concierge, it sounds unaffordable. It sounds untouchable, and this is not something for me. And I think that's why direct primary care physicians, don't really like to use that term. But in terms of making this an understandable topic for people, I am going to use that word. So traditionally, concierge medicine came with this large price tag where patients might pay $5,000 a year or in some cases even a month to have a physician take care of them. And that level of care would be astronomical though. That physician would follow you wherever you went, to the hospital, to the school, on vacation and what have you. Yeah. And really like concierge medicine to some extent is really for the people who have a lot of money. And direct primary care is medical care for everyone. And the mission is to provide affordable care for everyone and high quality. And so with that, the price tag is a lot less. So, I would call it a modified concierge. And sometimes I think the best way to wrap your brain around it is to think about it like a gym membership, and you kind of have like a gym membership to your physician. So when we think of gym memberships, we don't think, oh my gosh, I can't afford to be a member of a gym. But most people can afford to be a member of a gym because they're generally $40 to $200 a month, depending on, your community and so forth. And just like a gym membership, you get to see your physician anytime that you want. You get to communicate with your physician anytime that you want. And that membership fee covers all of your visits and all of your care. So there's not like other charges, for things that you might get done in the office, like say an excision or a wart removal or a physical or a chronic problem review or what have you.
Excellent. And would you say that this direct primary care appeals to those with or without insurance? Does it matter?
No, it doesn't matter at all. I think for patients who don't have insurance, it's a way for them to get medical care that they didn't think they'd be able to afford because the membership fee is low enough for them to be able to afford. And most direct primary care offices, mine included, have researched and contracted prices for labs and x-ray studies for cash prices that are very affordable and many times a lot less than the sticker price that you get from the insurance. So for the uninsured, it provides a way to get care that they can afford, and that's high quality, better than they would have gotten, say, with like straight Medicaid. Now, for those with insurance, it also can be appealing because some people have a host of medical issues and they might need more than that 10-minute or 15-minute visit that they're allotted, in a standard medical practice. And they don't want to be told, okay, you talked about your one problem, come back tomorrow or next week and we can talk about the rest. Yeah. I don't think that design really works for people. Or for the physician, as long as we're both in the room, let's talk about all of the things. So for people who value their healthcare and value their time, I think that this type of membership is very appealing. So therefore, there's benefits for the uninsured and benefits for the insured.
Excellent. And so either way, it can fit for you. And I'm assuming that this also works for, if we think about our audience, folks that are on Medicare or soon will be.
Yes. So direct primary care offices, the majority of them are not contracted with Medicare or with any other insurance. And the reason for that is we don't have to be subject to their rules. For example, one rule, which I sort of touched on with the last question, was doing more than one thing in one day. Insurances and Medicare do not like you to do more than one thing in one day. So if you're not contracted with them, then you can do more than one thing in one day. It's just more common sense. You know, a lot of things that Medicare or insurance does, doesn't feel like common sense. But Medicare will not pay for the membership, and it would even be fraudulent for you to try to get reimbursement in that way.
Sure.
But your Medicare does work for the labs and the tests. You can always apply your insurance to everything else.
Yeah.
It's just that one little thing. But most of my Medicare patients really appreciate the increased access, and they don't mind what they consider a small fee, for quality to their healthcare.
Sure. And what generally, if someone signs up for direct primary care with a doctor, what's kind of generally included in a membership like that?
Well, I think that a lot of direct primary care offices are probably a little different. But with ours, I always try to show value with our membership. So for one, it includes like all of your care, your yearly physical, EKG, labs, chronic problem visits, lump and bump removal, sick visits, and so forth. But we also have a YouTube channel where we cover topics of interest for the members. Now, if the member doesn't give me a topic, I have plenty of ideas. So I've done interviews with specialists like knee specialists and eye specialists and fitness gurus, to kind of go over, the skinny on those topics. I've had patients, ask me questions about hypertension, and I've done a video for how we can improve hypertension without medications and so forth. The other thing that we do is we have weight loss programs. Okay. And for members, that comes at a discounted rate. We also have aesthetic care, and for members that comes at a discounted rate. And I think our members also appreciate that our aesthetic care is charity driven. So a portion of all the profits from aesthetics goes to women's and children's charities in the community, things like foster care, homelessness, and so forth. Because if we have a healthy community, then we have a safe community. So I think our members like, that uniqueness about our practice, and the ability to give back even when they're being indulgent with themselves.
Sure. And, I kind of know from personal experience, but you certainly are paying a monthly fee, like you said, like a gym membership, but there's also opportunities where a direct primary care physician and that arrangement can even save some money though, too, to help offset that. Can you tell us about that?
Oh, absolutely. Now, before I did direct primary care, I spent 20 years in a standard medical practice and would see 30 to 40 people a day. And even though I was, working hard to seeing a lot of people, everybody who needed to be seen wasn't getting seen. And there were acute sick people that maybe would be told, go to an urgent care or go to the emergency department, or you can have an appointment in 2 weeks or 3 months. Now, every time you go to the urgent care, it's priced about the same as the emergency department.
Yeah.
And you don't know who you're getting. Is it a nurse? Is it a doctor? Is it a medical assistant? You have no idea. There's not the continuity of care. That person doesn't know you. Yeah. They don't know what usually happens when this particular illness befalls you. So with direct primary care, our schedule isn't so packed where we can't see you every day. when a sick person calls in, I can definitely see them the same day, either by doing a video chat like we're doing right now, or have them come in the office. And that saves them probably $200 to $300, when you think about it, what it might cost for an urgent care or emergency department visit. And it may save them from taking, unneeded medications as well, because a lot of those urgent cares are tacked to a pharmacy, and pharmacies are in the business of selling medications.
Yes.
So I don't think I've ever done a follow-up for someone who went to a pharmacy-based urgent care who didn't come back with 3 or 4 prescriptions for whatever their ailment was.
Sure. Absolutely. So most of us our experience is, if we can get in to see our doctor soon, that we will be there. We'll be waiting a long time. When we finally get in with the doctor, we've got about 5 minutes of her time. And most of that time seems like she's typing in her computer, reading her notes, and then we're kind of in and out of there. And then after we leave, of course, that's when we remember, oh, gee, I should have asked A, B, and C. How is that experience different for someone who's using this model of care?
Well, it's completely different. So first of all, the membership is capped for every physician. So we don't see thousands and thousands of patients.
Sure.
We have a capped membership so that we're able to maintain the quality of care that you're signing up for. So my appointment times generally are 30 to 60 minutes, depending. So there's no rush. I might take notes with a pen and a paper, because sometimes I like to draw pictures and show people, things, but you will not see my head in a book or in a computer, because, you have to keep eye contact with someone, and you have to know, are they understanding me? And if you're not even looking in their face, then you don't know if they heard you correctly. I'm really old school with pen and paper for my patients. I usually let them leave with a to-do list that I've handwritten, and I review all the things that we've talked about and all the things that they need to do. And if it's a new medication or, insulin for the first time, we do the demo right here, because I know they're not going to get a proper education at the pharmacy, because the pharmacies are really busy, and it's daunting to start something new, and the directions are teeny tiny. So we spend as much time as you need. We get FaceTime, and because we get all that time, inevitably we get to know each other, and I feel like we do have a really close relationship with the clients, and they kind of feel like friends. And with that comfort level, better medicine happens. If you trust me and I trust you, then we're going to do the right thing together.
Excellent. So you know what your patients look like.
I do, yes.
So why do you think so many, not just patients, but even doctors are going to this model? Why are they so frustrated with the current system we've got?
Well, because doctors feel a little bit out of control, and they receive all of the blame for all of the problems that really is not their design. You go to medical school, you take an oath to do no harm, you want to do the right thing, but so many times you are literally shackled by the insurance company. They won't let you, if you're a cardiologist, they might not let you put a life-saving stent in somebody's heart. And it isn't really an option for somebody to pay out of pocket for that. So, but that's what the insurance always says. Oh, when we deny something, you always have the option of paying it for yourself. But, most people don't have tens of thousands of dollars, to pay for that kind of thing. So with direct primary care, a physician has a little bit more control and can feel good about what they're doing. Like, I can spend as much time with you as I want. I can research ways for you to get tests done or procedures done that are affordable. So whether you have insurance or not, we can get these things done. But also, because we have so much time with one another, maybe you're not going to need that big procedure, because we have so much time to dedicate to prevention, and you're going to understand what you're supposed to do on a regular basis so well that there'll be less complications and perhaps less need for those bigger and better things on the other side.
That's great. Because it does seem like in the current model, the doctors are completely unaware of what things cost. They just say, go get this procedure done or take this medication, and they don't even think about what it costs. So it's good to have someone who can, who is, like you said, already has done the research and said, hey, if you need an MRI, go to this place. It's going to be one of the more affordable places.
Sure.
So that's good. And as I think about our clients who are approaching retirement, healthcare becomes even more important. I mean, after 65 and you think about retiring, even someone who's been in really good health is likely, correct, to go see the doctor maybe a little more often?
Oh, absolutely. Because, usually once you get to be age 50, most adults have at least one, if not more, health problems. And the more health problems that you have, the greater risk that you have, for complications. And once you cross the age 50 as well, like any unhealthy habits that you've had in the previous 50 years are going to come to light. So if you've been a long-time smoker, you may start to experience some lung problems or heart problems. If you always ate terrible, maybe you now have diabetes. And, when diabetes gets diagnosed, really we need to talk with that person and be with that person really week to week, because it's a big learning curve. And it's a lot of new stuff, and it can be very overwhelming for that patient. So I like that I have the ability to handhold with that person so that we can see each other often. We can talk to you weekly if need be, and make sure that you know what you're doing and know that you're not alone and you don't have to figure this out by yourself. And I think when you have a quick 10, 15 minute visit and you're told come back in 3 months or 6 months, you're like, okay, what do I do now?
Right.
So I think that people over 50 and nearing retirement, deserve a dedicated health professional to provide that level of attention to their medical issues, because we don't want the little things to become big things.
Yeah, that makes total sense. I'm going to ask you a question that I don't like it when people ask me. That's looking into the future. So when you think about, the kind of the future of medicine, what are you thinking?
Well, I think that Americans don't like being told what to do. And, we're built on capitalism, and if they see a way to do something better, get something better, they're going to want that. And how I see these large corporate entities that are hospitals, that are clinics, I see them becoming more and more impersonal, giving people less and less time, making things more and more difficult and more expensive. If I had a nickel for every time I hear about people paying more and getting less, and it's not the physicians and the other healthcare providers that are seeing those dollars, it's business entities and non-physician entities that are really cutting our lines and taking those extra dollars that could be dedicated towards healthcare. So I think when patients realize that there's physicians out there dedicated to their care, and they can spend more time and they can maybe spend a little bit less money, I think they're going to jump on that. And I think in the future, you're going to see a lot more DPC practices, kind of like in the olden days. Sometimes I think about like the 1950s, what I imagine it may have been when, maybe someone saw their family doctor and didn't have money and brought them a chicken or something. To get their care. But, we need to be there for people, and relationships are important.
Excellent. That makes total sense. So if someone, how does someone find a doctor in their area who does this kind of medicine?
Well, you can search on the computer and type in direct primary care. There are some national registries that have not all of the direct primary care, but most of them. They are present in every state, maybe more so in the West Coast than here, but they're around here. There's plenty around here. So I guess I would start with the internet, word of mouth. Chamber of Commerce is also a good place to start as well. I'm a member of the Hoffman Estates Chamber of Commerce, as well as the Barrington, because our office is located kind of right in between South Barrington and Hoffman Estates. So kind of see clients from both of those areas. So if I were a patient, I might contact them, Chamber of Commerce, certainly
Sure.
the internet, and talk to your friends and neighbors, because they might be seeing a direct primary care physician and they just never mentioned it.
Yes. And my experience is when I talk to someone who has a doctor relationship like that, they speak very positively of actually being able to communicate with their doctor and ask questions.
Well,
So they'll be happy to tell you.
Yes, that's true. That's true. We do have 100% retention of our medical patients. Once somebody tries us out, they don't leave because they see the value.
Yeah.
They're like, oh my gosh, my questions get answered immediately. When I call at 8 a.m., they call me back at 10 after 8 or immediately.
Yeah.
I've had people ask me for refills, and then I refill it right away, and they're like, oh my gosh, I thought you'd do this tomorrow. I didn't want to bother you. It's Saturday night.
Yeah, that's neat.
But,
Well,
they're able to do that.
that's great. That is great. That has kind of been our family's experience too. And we have younger kids as well as older kids, but just the comfort of knowing that you can reach out to the doctor, someone who knows you, and you're less reluctant to call the doctor or email the doctor because you know that's why they're there and they're gonna respond to you. And that's really good.
And I think you touched on an important thought too. Like, I've often had new clients come in and say, well, I never go to the doctor. I go to my physical just once a year.
Mm.
But you hit the nail on the head when you said reluctant.
Yeah.
Well, usually people don't contact the doctor as often as maybe they would because they know, I won't get in for 2 or 3 months. The phone call isn't going to be answered. So it's just not worth it. So I've had a lot of my clients who thought they were just going to come for a one and done physical, because we do some cash pay one-time visits.
Mm-hmm.
They have all converted to members because of our attention to detail and our follow-up. And they see that, well, I guess I would be contacting the doctor more if I knew I was actually going to be answered.
Yes, absolutely. That makes sense. Really appreciate having you on the summit. If people have questions, what's the best way to contact you?
Well, we have a website where we have contact forms. So if you want to join or you want to have an initial meet the doctor visit, you can contact us through our website, which is www.mindfulmedispa-mediclinic.com. I know it's kind of long. And if you're not internet savvy, we have good old-fashioned phones as well. All of us have cell phones here because we want people to be able to text us as well as call or send pictures. So our front desk is 224-634-1500. And anyone who wants to become a new medical client can call or text that number and talk to the receptionist and get something scheduled. But we're very active on social media. So there's a lot you can learn about our practice and about what we do just by surfing some of those sources on Instagram, Facebook, and our website.
Wonderful. And we will have a link to your website right in our Retire Wiser Chicago Summit. If you are watching this, you can just click right down below and there'll be a link and they'll take you right over to Dr. Bianchi's website. So thank you so much. I really appreciate your time. This is, I think, a very helpful topic to folks as we think about retirement and entering retirement. So thank you, Dr. Bianchi. Appreciate your time.
Well, thank you, Jim. It was a pleasure to be available to your audience, and I hope more and more people convert to direct primary care because I do think it's the wave of the future.
Absolutely. Thanks again. Bye-bye.
Bye-bye.